So there's different words that we hear. There's strain, which is a physical force, and there's sprain. If you put strain on biologic tissues, body tissues, you can then develop a sprain. A sprain is a tear in a ligament, and ligaments attach muscles to bone. Cervical strain is anything that puts stress on the muscles and ligaments of the neck. And probably the most common thing outside of athletics is car accidents. We all hear about a whiplash mechanism injury, rear end collisions, and it can be an athlete running down the field and getting blindsided by another athlete and being hit in the body, and the kinetic force causes the head to snap in different directions. And even running full speed and being tripped, striking the ground, which is immobile, first with your body and then your head snaps to the ground, you're putting strain on the neck tissues. And that can lead to tearing of ligaments, which then becomes a cervical sprain, and can lead to subtle instability of the bony structures. The bony structures in the neck are there to support the neck, but also help enable movement, which places them at a higher risk of spraining than, let's say, a more relative immobile joint. The average human head is between 12 and 15 pounds. And a common object that's of the same weight are bowling balls. And everyone's been bowling, and you know how heavy that sucker is when you pick it up to shove it down the alley, right, to knock the pins over. So if you're in a 35-mile-an-hour rear-end collision, imagine trying to hold on to a 14-pound bowling ball during the accident, or running down a field at full speed and being tripped and trying to hold on to that 14-pound bowling ball. That's what we are asking our necks to do when we have these injuries. And that's an incredible amount of stress and strain on the structures in the neck.